back, everybody. It's been a long time. I'm about to talk to you about something so important and so unique that I may even shock my colleagues. I'm going to talk to you about a condition that people don't know about, but it's very prevalent. And the problem is that it causes so many diseases. We're going to talk about the Autonomic Dysautonomia syndrome. What does that mean, that mumble jumble? I'll make it very simple. The brain is broken up, the nervous system is broken up in two parts. The central nervous system and the wires. All these wires go to your organs like the heart, the kidney. They control the things that you're not even aware of. And somewhere inside your brain, it's monitoring how your heart is beating, how you're breathing. It's controlling your urination, it's controlling your sweating. It controls your blood pressure. It is the network of electricity that's working in the background without you even knowing about it. So just try to imagine if something can do damage to this wiring. And the answer is yes. The problem is because when you get damage to this wiring, the effects are diverse. Like, for example, you're going to have people that have sweating, excessive sweating, problems with excessive hearing or problems with hearing. But the most important part about this syndrome is that your blood pressure drops. And the problem with this syndrome is that you go to doctors and they can't find a thing and they think that you're crazy. You're not crazy. The doctor needs to do a little more research. Autonomic dysautonomia is a very common syndrome that often is missed by medical doctors. The problem is that we try to use technologies to find diseases. You have a headache? Let's do an MRI. You have something in your abdomen? Let's do a CAT scan. Everything is technology, and many doctors have forgotten the basic foundation of anatomy and physiology. So you scratch your head. Who the hell is looking this up? I will tell you why. It appears that now with this COVID outbreak, it seems to have people having problems with brain fog, a symptom of autonomic syndrome. People having problems with tiredness and fatigue, autonomic syndrome. Because when you go to the doctor, they said, we can't find anything. Of course you cannot find anything. The only way you can diagnose this, and you talk to your cardiologist, it's called the tilt table test. Aha, look it up. You guys are smart, you do a lot of research. The tilt table test will tell you if your blood pressure changes, and it's the key to the diagnosis. So why is this so important? Because it affects every organ system. Headaches, migraines, fatigue, tiredness, inability to think. There are people who walk into the cold and they're shivering and the temperature is not even cold. Problems with sweating and problem with palpitations. Because these syndromes affect every organ system, it becomes the most difficult one to treat. Yes, you heard it here on my channel. I've been treating this condition for years. Not me personally, but I refer to the right doctor. Problems with autonomic syndrome, because people suffer from this, their brain, it gets overwhelmed and they're nervous, they're depressed, they're hopeless. It is not true. You can get help. The center of attention now has become COVID because it appears that spike protein, and they're doing a great deal of research, that the spike protein is causing problems with autonomic syndrome. You never heard of this, but you heard it here. So I want you to look up some of this information, but you can always call us. You can look me up at the YouTube channel to answer all your questions regarding this matter. The key to my channel is called Mind Hijacked. Your brains have been hijacked to believe that you're always sick and there's no solution. I was trained many years ago as a surgeon that if you don't know what you're looking at, how are you going to fix it? That same principle I have brought to psychiatry. Doctors, you have to know what you're looking at before you know what you're treating, because your patient is going to get disappointed in you and you're going to make him feel more depressed. So how do we treat this? You doctors are listening to me, right? Because you want to treat this. You know what? I will tell you how we treat this condition, okay? The most important thing we need to do is we have to do a complete evaluation, mostly cardiology and vascular. The tilt table evaluation is done in a cardiology office. This is the first symptom and suspicion that you have autonomic syndrome. So when you have this condition, your nervous system is out of whack. So one of the things that we have learned that we can treat with, believe it or not, is stimulants. Yes, stimulants. And not just stimulants, there are other medications you can help. Because when you identify an autonomic syndrome, the most important thing you have done to your patient, doctor, is that you give them hope. And you just activated a self-healing mechanism because now the patients can focus that they're not mentally ill. This hope is very important because when you break down this barrier that you discovered something, patients feel that they're going to get better. And whether you like it or not, that placebo thing that we talked about in my previous videos, you will see that basically that placebo effect is very powerful. That placebo effect, in which 30% of the people have this belief that they're going to get better, does work. And that could be a topic of a future video where I can describe to you what activates the placebo effect in the brain neuropeptides that causes the patient to self-heal. The fact that you're able to describe a diagnosis, the patient begins to do things for themselves. Like, for example, if you happen to be overweight, they get motivated by losing weight because apparently exercise finds a regulation of certain peptides, including endorphins. And these endorphins seems to modulate the syndrome. So exercise, in certain amount of exercises, can improve the syndrome. So it's not just medication, it is exercise and the modulation of your diet, right? Because basically the problem with autonomic syndromes, when you eat too much sweets, it seems to be a problem with insulin. Insulin seems to go up too quickly and the patients get very tired. So the fact that you have a diagnosis, you already have approached the treatment. And for those who cannot take medication, a lot of these people suffer from depression. They qualify for a condition and treatment called transcranial magnetic stimulation. One of the best treatments, and by the way, we do it here, one of the best treatments to help people that cannot tolerate medications, because one of the problems with the syndrome, they have a lot of problems with medications. But even if you have problems with medication, always remember to ask your doctor to do pharmacogenetics. If they don't do it, we do it. And we can determine which medication is best for you. The message I want to give you that there's treatment and there's hope, and this is very important, but it's up to your doctor to be very smart and go back to his medical books and Medicine 101 and find your problem and not put the blame on your mood and your brain because you really have a medical problem. I hope this has been very helpful, and there will be more topics as exciting as this, and stay tuned. Next time I will do a show on something that very few know about, hypnosis. You're interested, aren't you? I'll see you in the next program. Thank you and goodbye.